Hi, I'm Dr. Denise Jagroo. Thank you so much for downloading Stop Leaking, 7 Surefire Steps to Stop Peeing Your Pants. Yes, it's a silly title, but if you're watching this, I'm pretty sure you know where every accessible bathroom there is on the way to work in the morning. You probably know where every emergency bathroom stop is. You probably know where every rest stop is on the highway that you drive to your relative's house on the weekends. And you probably know that you can't take that exercise class at the gym that you've been wanting to take because if you jump too hard, you'll leak a little bit. And you probably think that this is all normal. Perhaps you've had children. Maybe you're just getting older and you think that this is just a normal part of life. Just because something is common doesn't mean that it's normal. And I'm here to tell you that all that is absolutely not true. You can absolutely stop leaking. And I'm also here to tell you that you are not alone. The National Institute of Health states that 1/3 of all women in the United States alone will develop some type of pelvic dysfunction in their lifetime. Pelvic dysfunction includes leaking. And the other 2/3 of women are just lying. I think that anyone who says they've ever sneezed and never leaked one drop of urine is lying, or they're not talking about it. So how much is 1/3 of all women in the United States? According to the national census, there are 150 million women in the United States. So 1/3 of that is 50 million. But I think that's a modest statistic. I think everyone at some point suffers from pelvic dysfunction, including leaking. And we haven't even talked about men, that's just women. There's a really emotional component to leaking urine, isn't there? And like I said, you are not alone. There are so many women in the United States dealing with this on a daily basis. But if you follow these 7 simple steps, I guarantee that you'll eventually be dry and get back to living your life. And I know you don't like the word incontinence. Maybe it makes you think of an elderly person in a diaper. But did you know that if you leak even 1 drop of urine, you're incontinent? If you leak gas, you're incontinent. The job of your bladder is to store urine. The job of the muscles and the base of your pelvis wrapping around your bladder, your pelvic floor muscles, their job is to keep the urine inside your bladder and keep your bladder closed. So even leaking 1 drop means that your bladder and those muscles are not doing their job. And you just need to remind them a little bit. So let's talk a little bit about your bladder. This is your bladder. Now, maybe sometimes you feel like you have to go to the bathroom and you run to the bathroom because you feel like your bladder feels like this, like really full. But then you get there and only a little bit of urine comes out and your bladder is only full this much. Why is that? We'll be talking about ways to control this throughout the 7 steps that we're going to go over. There are sensors in the wall of the bladder, and they give signals up to your brain, telling your brain when there is fluid in your bladder. Now, that doesn't mean that you have to get up and go to the bathroom. That's a behavioral decision. So sometimes what ends up happening is that we train ourselves to go to the bathroom often, and we train ourselves to have urinary frequency. So let's take a little bit of a quiz, okay? When do you think that the sensors in the wall of the bladder give that first signal to your brain that there is fluid in the bladder? When your bladder is 1/4 full, half full, 3/4 full, or completely full? So when your bladder is only half full, that's when the first signal goes to your brain to say that there just is fluid. It's just a hint. It doesn't mean that you have to get up and go to the bathroom. So this is the problem, is that we tend to train ourselves to go to the bathroom often. So we'll be talking about ways to try to control that so you're not going to the bathroom all the time. Let's take another quiz. How many times a day do you think it's normal to go to the bathroom to urinate? 1 to 3 times? 3 to 5 times? 5 to 7 times? Or 7 to 10 times a day? The answer? 5 to 7. If you're going to the bathroom more than 7 times a day to urinate, you have urinary frequency. If you're going to the bathroom less than 5 times a day, you may be holding your urine too much and for too long, and that may promote a urinary tract infection. You want to be going at normal intervals. So let's take another quiz. How long should you wait in between trips to the bathroom? 1 to 3 hours, 2 to 5 hours, or 5 to 8 hours? The answer? You should be able to hold your urine at least 2 hours and up to 5 hours a day. If you're going to the bathroom every half hour or every hour, that's too frequent. If you're holding your urine more than 5 hours a day, maybe you sit at a desk for a long time, or maybe you're a teacher and you can't get away from the classroom. That's not good. You don't want to be holding urine and concentrated urine in your bladder for too long. That will promote a urinary tract infection. You want to be voiding again at normal intervals throughout the day, and we'll talk about how to manage that later. Let's take one more quiz. How many times during the night do you think it's normal to get up and go to the bathroom? 0 to 1, 1 to 2, or 2 to 3? The answer? 0 to 1. It is acceptable to go to the bathroom 1 time during the night if you are older than 65 years old. You do not want to be getting up during the night to go to the bathroom on a consistent basis for a couple of reasons. 1, you don't want to train your bladder to wake you up at night. Every time you get up to go to the bathroom, you're responding to that signal that's telling your brain that there's urine in the bladder, but that doesn't mean you have to get up and go to the bathroom, especially at night. It's okay to wait a longer interval during the night and not get up and go to the bathroom. Your bladder knows and your brain knows that you're sleeping, and it's okay to hold urine up to 8 hours for that time. And it's normal to have a larger urine output first thing in the morning when you go to the bathroom, when you wake up. Getting up in the middle of the night disrupts your sleep, and it makes you less productive during the day. So getting back to living your life means getting a full night's rest and being as productive as you can during the day. I know some of you are in the habit of keeping a glass of water on your nightstand and drinking water in the evening, close to bedtime, or throughout the night. And I want you to try to break that habit, unless you have to take medication or you're extremely dehydrated at night. We're going to be talking about shifting your water intake and fluid intake earlier in the day and not drinking at least 3 to 4 hours before you go to bed. So let's talk a little bit about incontinence. There are different types of incontinence. There's stress incontinence and urge incontinence. Stress incontinence is a loss of urine upon exertion. So when you cough, laugh, or sneeze, or jump, and you lose a little bit of urine, that's stress incontinence. There's no anticipatory feeling of needing to pass urine. You may not feel that you have a full bladder. Maybe you don't even feel like you have to go to the bathroom. But when you sneeze, cough, or laugh, or jump, you lose a little bit of urine. Sometimes patients ask me, well, I don't know if I'm leaking urine. How do I know that it's not sweat? How do I know when I'm working out and my underwear is wet? How do I know whether that's sweat or if that's urine? Now, make sure that you ask your doctor first before doing this, but there's an easy trick to figuring out whether you're leaking urine or you're just sweating. You can go to your local pharmacy in the urinary health aisle. There's something called pyridium, and this turns your urine orange. So you would just take it as directed. It's harmless, and if you take it for 1 day, it'll turn your urine orange. And what you want to do is wear a panty liner when you do your workout. If you see little drops of orange on the panty liner, then you know that you're leaking urine. Urge incontinence is leaking urine involuntarily associated with a strong desire to void. This is also called key and lock syndrome, because when you get closer to the bathroom, you start to get a little more anxious, and maybe when you're getting to the front door of your apartment or your home and you're trying to get the keys in the lock, you get anxious and you may leak a little bit of urine. And we're going to be talking about ways to combat that later. There's also something called mixed urinary incontinence. And most people have this. Hardly anybody has just stress incontinence or just urge incontinence. Most people have a mixture of the two. But we're going to be talking about how to prevent both stress and urge incontinence throughout the video. Okay, now we're ready to get into the 7 surefire steps to stop peeing your pants. So just click on the link in the description box below, and I look forward to you joining me. We're going to be doing a lot of exercises. You're going to be learning a lot of techniques and tips to help keep you dry and get you back to living your life. So let's go.